Penis size is a real taboo among men. For most people, having a large penis with a good caliber is practically a sign of virility. The doubts that arise in internet search engines are the most varied. How to increase the size of the penis? What is the ideal penis size? What is the average Brazilian male organ size by age? Stay in this video to understand what the average penis size is for most men and when the sexual organ is really small. What is the normal size of the penis? Doubt about the normal size of the penis can arise in childhood and adolescence, often caused by ancestral issues that link the male sexual organ to power, virility and potency. As you can see, it is not a modern concern. Apparently it is an issue that has been addressed since the dawn of civilizations, but today even pornography addiction can give rise to an erroneous idea about the true size of the organ. The size of a man's sexual organ will be determined by genetics, and of course, the size of the penis by age will vary, but the average is that by the age of 19, most are already with the organ at its maximum development. Although most men are concerned with these dimensions of the organ itself, studies carried out so far have shown that the average penis size it may even be smaller than many think. But, in general, many men consider that the average penis size is around 15 centimeters. Some studies have also indicated that the average size of Brazilian male organ is around 15.75 centimeters, but one of the most recent and comprehensive studies on the subject, carried out by King's College London and published in the British journal International, proves that this is not the case. This study involved 15 men from several countries, and demonstrated that the average penis size is around 13 or 12 centimeters, in erection. Regarding caliber, the average measurement is 11.6 centimeters in erection. On the other hand, a Brazilian study, published in Journal of Pediatrics, reveals that the average size of the Brazilian male organ may vary one dimension greater than the King's College study, placing measurements between 14.2 and 15.7 centimeters. The Brazilian study for the calculation of Brazil's penile average included 2.010 children and adolescents aged between 0 and 19 years old. But miscellaneous international studies have shown that, in general, the normal penis size will vary between 8 to 23 centimeters. However, only 0.5% of these men would have a penis measuring less than 10 centimeters and 4.5% measuring more than 17.5 centimeters. Regions and ethnicities are aspects that can make this number vary. However, in our country, by all indications, the average size of the Brazilian penis revolves around that number mentioned above as well. In addition, it is important to emphasize that the population of Brazil is composed of a great miscegenation of ethnic groups. After this study, there were also questions about how to measure the size of the penis. Many experts point out that if this shape is not a pattern, there may be many variables in the results. The correct measurement should extend from the pubis. You have to push the skin, so the tape or ruler is close to the pubic bone, to the tip of the penis. Average Brazilian male organ size by age. According to information from the Brazilian Society of Pediatrics, the penis has 4 stages of growth: gestation, from 0 to 3 years old, from 3 to 11 years old and from 11 to 18 years old. 1. From gestation to birth, 3.7 centimeters. 2. From 0 to 3 years, there is an increase of 1.5 centimeters. 3. From 3 to 11 years, another increase of 1.5 centimeters. 4. From 11 to 18 years, increase of 6.5 centimeters, points out that the Brazilian average penis is 14.3 centimeters. These measures put the average size of the Brazilian male organ as being slightly larger than in other countries. International study of the average male organ size. I already studied the Scientific World Journal points out that the average size of a penis may be a little smaller than that indicated in the Journal de Pediatria. See the measurements as pregnancy. What is the ideal penis size for women? The expectation of enlarging the penis is much more of men than of women. A study by the University of Canterbury revealed that while most men themselves considered an ideal erect penis size to be around 78 centimeters, women preferred an inch less. According to sexologists, women are more concerned with what men are going to make them feel at the moment of sex, such as perfect foreplay, than with the size of their sex organs. Is it possible to increase the size of the penis? Due to these expectations regarding size and caliber, many have been looking for ways to thicken the penis and even understand how to enlarge the penis. In fact, increasing the size of the penis is the dream of many men. In Europe and the United States, cosmetic surgeries related to penis enlargement are already performed. In Brazil, these surgeries are only indicated for functional cases or when the organ is really very small, also defined as micropenis. In these cases, the man has an organ that measures 4 centimeters in a flaccid state or up to 5 centimeters in an erect state. Another pathology that can lead men to have a smaller than average penis size is cases known as embedded penis, which is when the penis is hidden under the skin or fatty pad of the pubis, in general, due to the patient's excess weight. In general, this organ has a normal penis size, however, it has this difficulty in exposing the shaft. Another reason for men to consider increasing their penis size is that they may suffer from a condition known as penile atrophy, which causes the sexual organ to shrink in size and caliber. This problem can occur if the patient has erectile dysfunction, has been in disuse of the penis for a long time, has Peyronie's disease, or has had prostate surgery. In these cases, you can resort to treatments such as erectile dysfunction, which can range from taking vasodilator drugs to penile rehabilitation, Peyronie's surgery, or even penile prosthesis implantation. Penis enlargement approaches. To produce penile enlargement, it is currently possible to use some traction techniques, such as penile pumps, for example, in cases of rehabilitation, and to increase the caliber there are injectable treatments and filling techniques. Regarding penile enlargement surgeries, procedures such as 1. Specific penile extenders. 2. Thickening with hyaluronic acid, Eurofill technique. 3. Suspensor ligament section. 4. Liposuction of the pubis, cases of an embedded penis. 5. Correction of penoscrotal synechii. 6. Pneumatic implantation. 7. Disassembly of the penis with cartilage graft, which is a very aggressive technique. Conclusion. It is more than proven that the size of the penis interferes with the image that the man has about himself. If he has doubts in this aspect or wants to look for a way to promote penile enlargement, he needs to seek a specialist in these medical procedures related to male sexuality. Thanks for watching.